So thank you guys for having me back. My name's Anna, and I just graduated in May from OSU's. My doctoral project was on mindfulness, specifically for the neurological population, but mindfulness is for everybody, kind of like we talked about last time. So I'm excited to be back and exploring the benefits of mindfulness for kinship caregivers. So we're actually going to dive right in and do just a very brief practice. It's called like grounding meditation, just going to be a few minutes to kind of get us out of our heads, into our bodies, and bring us all together in this moment. So I'll ask that you guys take a moment to just find a comfortable posture, a comfortable seated position. Maybe that's with your feet, both feet flat on the ground, sitting upright, and allowing your eyes to close gently if that feels okay, or just lowering and softening your gaze. And then bringing attention to the points of contact that your feet are having with the floor. Just sensing into your feet, noticing the solidity of the ground under your feet, maybe feeling where your shoes or your socks are in contact with your feet. And now moving up the legs to your thighs and your buttocks, noticing where they have contact with the surface beneath you. And allowing the ground and the chair or whatever surface you're on to hold and support your body without you needing to do anything. And now moving your attention to your back, noticing where your back touches the back of the chair, feeling the difference between where there's contact and where there's none. And moving your attention into your hands, sensing into your hands, maybe noticing their position, noticing what they're touching. Perhaps they're touching the chair, resting on your thighs, or maybe one hand is cradled in the other. And now opening your awareness, feel your entire body sitting here or standing here in this moment. And for the last few moments, bringing your attention to your breath. Seeing where you feel it the most, or maybe where the sensation of your breath is the most pleasant. And if you like, taking one big deep breath, and letting that go, and when you're ready, opening your eyes to this new moment all together here. I'm gonna keep moving, but we will do another practice and have some discussion time about that. Last time I talked about this definition of mindfulness, and that's just that mindfulness is paying attention on purpose to the present moment and doing so non-judgmentally. And I wanted to talk about this one, kind of the same thing, just getting at, there's really two parts to mindfulness. It's that self-regulation of attention. So we are purposely attending to the present moment, our immediate experience and what's happening around us. And we're doing so with that non-judgment, with curiosity, openness, and acceptance. And last time I talked about this picture, just illustrating that so often as humans, we're missing out on the present moment we're either rehashing the past or rehearsing the future. And I talked about the dog and how they are living in the present, but I really wanted to take it this kind of like one step more and just kind of flesh out what mindfulness is and what it isn't, because it's not really just living in the present moment. It's doing so with full conscious awareness, and we're doing that like by choice, and we're noticing all the sensations that we're having. So it's kind of like one step further. So if you're really kind of picking apart this picture, you might say that the dog is living in the present, but are they really being mindful? Maybe not, because they just don't have that like extra level of insight and purposeful conscious awareness of their experience that we as humans are capable of. And we went over these 9 attitudes of mindfulness last time. I'm not going to go over all the definitions, but I just wanted to read them off to you to kind of remind you what I'm trying to sort out these pictures. They're like blocking my slide, sorry. Just to kind of remind you the attitudes that you should have when you're practicing mindfulness, or either just some helpful attitudes to kind of practice throughout your day. So these attitudes are kind of the foundation to mindfulness practice, and they are patience, acceptance, trust, non-striving, letting go, non-judging, generosity, gratitude, and beginner's mind. And then another reminder, I know we went over this last time, but there's really 2 types of mindfulness practices. There's that formal, which is when you're kind of doing those formal meditations, and it's mindfulness meditations. Or there's informal, where you're trying to do the same thing. You're still trying to dwell in that present moment to moment awareness, but you're going about your daily activities. And really, in both formal or informal, you're doing one of 2 things. You are either paying attention to the present moment, or you're noticing that you're not paying attention to the present moment and you're gently guiding your attention back to the new present moment. Now we are going to dive into a mindful eating practice. I'm going to stop sharing for just a second and give you guys a second to grab whatever you have available. Traditionally in like a mindfulness program, this is introduced with a raisin, just something that's kind of like small, unassuming, maybe something some of us have like an aversion to, not too excited about. A grape is perfect. I don't know if that's what you have, Jackie, that's great. Or like a nut, a pretzel, whatever you want to do. I did this earlier myself with a Cheerio, and that was fine. So whatever you find. Might all have different experiences if we all do something a little different, and then we'll just have more to share. So eating is something that we do like every day, of course, multiple times a day, but it's something that we just do so habitually, or we do like while we're doing something else, like talking to somebody, watching TV, even some people do it while they're driving. And it's something we just really don't give full attention to. So that's what I'm going to invite you to do today. We're going to go through eating just one simple item pretty slowly. So try to bear with me. I know there's probably going to be several urges to just like chew and swallow real fast, but I'll guide you through the whole thing. And yeah, we'll dive into this mindful eating practice. I do want to bring up that attitude of a beginner's mind is really important here, because everybody kind of grabs something they have from the house, so it's probably something they've eaten 1,000 times before. But I want you to approach this with a beginner's mind, as if this is something you're experiencing for the very first time. If it's helpful for you to think of it, you can even think like you are an alien from another planet coming here. You have never seen a food like this before, and you're just really kind of curious, and you're going to use all 5 of your senses to kind of explore it. So I want you to pick up whatever you have and place it in your hand. Again, pretending like you've never seen anything like this in your entire life. So just tell me maybe some things that you're seeing. Just go ahead and focus on the object, scan it over, let your eyes explore every part of it. Maybe turning it over in your fingers, noticing how it moves, its color, noticing folds or any ridges, places where the surface reflects lights, or places where it becomes darker. What's something that you guys are noticing? So now we'll kind of move on to touch, noticing how this feels in your hand, turning it over between your fingers, in your palm, exploring any texture, feeling softness, hardness, coarseness, or smoothness. If it helps, you can even close your eyes so that you can really focus in on those sensations of touch. So if I were maybe your alien friend here, what's one way that you might describe the feeling of touch that you're having right now? We're gonna next bring it to your ear. Maybe squeeze it, rub it, roll it. What sounds are here to hear, if any? I want you to slowly tape the object to your mouth without putting it inside. Notice how your arm knows exactly where to go and what movements to make to get it directly to your mouth. Touching it to your lips, maybe becoming more aware of your mouth watering and that urge to open your mouth. Recognizing what this feels like when it touches your lips. Is this the same or different than what it felt like touching with your fingers? Now go ahead and gently place it in your mouth. Place it on your tongue without biting. And feel it with your tongue. How is this a different sensation? Maybe even noticing if there's a reaction or a lack of reaction that the object is having with the saliva in your mouth or on your tongue. And when you're ready, feeling like you can just bite down, maybe just once or twice, and recognizing or noticing what happens. Maybe you notice that it automatically went to one side of your mouth to chew. Just paying attention to any taste that it releases, or perhaps any other fluids or anything. And you can slowly begin to chew the object.
Oh, I cheated.
Maybe noticing the urge to swallow. Try not to just yet. It's just an urge, and we don't have to give in to every urge that we feel. Be aware of the saliva in your mouth. Notice the sensations of the taste and the texture and how these are changing moment to moment, as well as the changes with the object itself. And try to continue chewing until there's very little left of the object. Pay attention to how your tongue and your cheeks expertly position the remaining bits so that they're between your teeth for chewing. And when you're ready and when you decide, you can go ahead and swallow, sensing it moving down your throat into your esophagus on its way to the stomach. And kind of noticing, having this feeling that you are exactly one raisin, carrot, goldfish, grape heavier.
Never thought about it that way.
I know. What are some things that you guys kind of noticed, or some things that you learned from that practice? Yeah, so it sounds like we've noticed kind of maybe a lot more with our different senses than we have in the past. Those things are always there, of course, but like we just don't pay attention to them. And it is super common for people to say, like, I enjoyed that so much more than I normally would have, just like that one goldfish or whatever it was. And sometimes people are like, wow, I really like rush and eat, and I've just never have some people say before I even finish one bite, I'm like grabbing a handful of more to put in my mouth. And it's just like hard to just focus on that one bite from start to finish. It's a good kind of urge surfing, they like to call it, exercise. Just kind of riding out that urge and not giving into it. Did anybody notice where their attention was during the exercise? That's one that you can easily kind of incorporate into your day, because how many times a day are we eating? And it's not like you have to sit down and do that with every bite of your whole meal. That would take you forever. But maybe you're just sitting down and like going through your 5 senses of your first bite of every meal, just to kind of bring you into that present moment. And you might find that you enjoy that meal a little bit more, and you're just not caught up in kind of the worries or what you have to go and do next. You're just able to sit there and kind of enjoy that meal. Now I'll go into just a couple techniques. This one I'm sure people have heard of. It's pretty common, but I love it. I know it's so simple, but it's just sometimes the simplest things are the best. So this is box breathing. And if you haven't heard of it, it's really just a kind of relaxation breathing technique that you could use at any point throughout your day. So I love it because it's pretty simple to remember. The breath is broken into 4 parts. So you're breathing in, you're holding your breath, you're breathing out, and then you're holding your breath again. And each part you're doing for 4 seconds. That's why it's called the box breathing. And then you can also kind of just focus on the breathing portion, or you can bring in some like movement with it and maybe like trace the box in the air. Maybe you're like at your desk and you have a Post-it note that you want to trace. Or like if you wanted your child to do this, maybe at their desk at school, maybe they have like a box taped on their desk out of like clear tape, and they can just like trace it. I think it just, when you're tracing and doing that movement component, it just is like another thing to kind of bring your attention in and along with your breath, and kind of help regulate kind of your nervous system in that way. So this one you can repeat as many cycles as you need. You can even do like just 4 cycles, 3 cycles, however many you need. So let's go ahead and practice now. And we'll just do 2 cycles and just notice how much maybe calmer you feel after just 2 cycles of this. So we're going to breathe in for 1, 2, 3, 4. Hold 1, 2, 3, 4. Breathe out 2, 3, 4. Hold 1, 2, 3, 4. And breathing in 2, 3, 4. Hold 2, 3, 4. Out 2, 3, 4. Hold 2, 3, 4. Like I said, super simple, but really effective. And then this one is called the 3 Ps. So this was actually comes out of the University of Wisconsin family medicine practice, and it was initially for healthcare providers who are going in and out of a lot of doors all day, every day. And so the point of this is every time you reach for a doorknob throughout your day, practice these 3 Ps. And that is just to take maybe 1 second, maybe 1 breath, to pause, be present, and then proceed. So every time you reach for a doorknob, just taking that moment to stop, briefly let go of whatever you're about to go and do, and just completely tune into this moment, being aware of what's occurring, maybe scanning through your body, noticing any sensations that are standing out, noticing any thoughts or emotions, and just being aware of them without judgment, without trying to change any of them. And then you can proceed. So maybe that looks like responding compassionately to whatever needs just arise from kind of that quick body scan, giving yourself some self-compassion, or proceeding, going on the other side of that door and doing so mindfully, bringing that mindful presence with you, and bringing some mindful speech or mindful listening to whatever activity you're going to go do next, or whoever you're going to go talk to next. So I love this. It's so simple because we go in and out of doors all day, even just as regular people, not providers. And it's something that we can also easily kind of incorporate into our day, just like a little pause and check in. And even just taking like the deep breath is so helpful. And And you don't just have to do like a doorknob, like maybe you're doing it when you open the fridge every day. Maybe you're doing it when you, like every morning when you get in your car or whatever. Just like a good cue. So I really like that one. Looks like we're looking good on time. So I think we will go ahead and do a body scan meditation. So this one will be around 10 minutes. And the people here are kind of shown in the traditional positions that people take for this practice. So you can absolutely do it laying down if you would like. If you do that, I would say just get somewhere comfortable, try to lay on your back if you can. You might need like a pillow or a blanket to go under your knees to relieve any low back pressure, and maybe something under your head. Or you can be like the gentleman and just be seated in your chair. And the best position will be not slouching, not rounding your shoulders, trying to sit upright in kind of a dignified posture, and having your feet flat on the floor and your hands resting comfortably. So now we're going to go ahead and close your eyes or just soften your gaze so you're not staring at any one particular thing. And sense into your body laying here, feeling any areas of contact where your feet are touching the ground or the chair. Maybe the legs, your back, the arms, the head. Noticing your breath entering and leaving your body. And now moving down to your feet. Sensing into both feet. Maybe feeling your toes, or maybe not. Maybe feeling some tingling, noticing temperature. And now moving your attention to your ankles and your lower legs. Saying what is here to feel, if anything at all. Maybe pressure of your calves against the floor or the chair. Maybe noticing the fabric of your pants against the skin. And now letting go of the lower legs and moving the attention to your knees and your thighs. What is here to feel? Maybe some pressure, temperature. Maybe noticing the position of your legs. Numbness also counts as a sensation in this practice. If you notice your attention is suddenly somewhere else, just gently, without judging, return it to your legs. Using your attention, maybe imagining it's like a flashlight shining light upon these areas. Or imagining your breath breathing into these areas. Letting go of the thighs and moving the attention to your lower trunk, the pelvis, the belly, up to your belly button. Noticing any sensation in this area. Maybe feeling the breath in the lower belly or not. And noticing that thinking about an area or picturing it is different than actually feeling it. And moving up to the upper trunk, the stomach area, the chest, feeling any sensations of the breath with each inhalation and each exhalation. Feeling the spine against the floor or the back of the chair. Noticing any sensations that are here or the absence of sensations. And now moving the attention into your hands, feeling your hands. You might notice how well we can feel our hands without having to see them. You can feel the individual fingers, the position of the hands, when you're ready, moving the attention to the wrist and the forearms now. What is here to feel? Touch, pressure, warmth. And now moving the attention to your elbows and your upper arms. Noticing any sensations here. And if your mind wanders off, just bringing it back to wherever we are, just starting again. From here, moving the attention to your shoulders, the back of your neck, perhaps noticing any tension. And up your neck, moving into your head, feeling your jaw, feeling into your face. What does your face feel like? Your mouth, nose, cheeks, eyes, forehead, bringing your entire face into your awareness. And now opening the awareness to include the entire body. Alive, breathing. If you like, you can imagine the breath flowing through the body, maybe in through the head and all the way down out through the toes. Just noticing any sensations of the body, allowing them to be just as they are in this moment. And now allowing some gentle movement back into the body. Maybe like wiggling your fingers or your toes, stretching or moving the body in any way at once, if that feels good. And when you're ready in your own time, opening your eyes and coming back to a seated position if you're laying down. Coming back to this new moment. I will open that up again for reflection if anybody wants to kind of discuss what that felt like or anything they found challenging or pleasant. Just like another tip, I'll skip to this one. So this is just like another check-in that you can do kind of throughout the day, just doing like a very quick, like maybe you're doing a minute body scan, head to toe or toe to head, checking in on some major areas. So places that we commonly kind of hold a lot of tension are in like our forehead, our brow, our jaw, our shoulders, and sometimes like our fists are clenched. So this is just kind of like a deep or a quick body scan that you could do, just kind of systematically relaxing your face, your jaw, your shoulders, your hands, and then taking a couple deep breaths. And then the last kind of tip that I had, this one is called safe. So this kind of brings in those compassionate attitudes and kind of intentions that we talked about last time. So this stands for just softening around a strong emotion, allowing or acknowledging that it's there, and kind of recognizing where in your body this emotion might reside. Then checking in, saying, what do I need right now? Maybe you're thinking that you need kind of some safety. So saying to yourself, may I be safe? Maybe you need some peace. May I be at peace? And then expanding this friendly wish to all people who are experiencing the same thing. And I will put these in like a little PDF again for Angela to give you guys as a handout. So you have these, and these are just like little tools that you can use to kind of bring a little bit of kind of calm and mindfulness, check in with yourself, your body, and those bits of compassion as well.
Could you give an example if there's time?
Of the safe.
Yeah, like just kind of talk through it.
Yeah. This is just really like bringing it into your daily life. Like maybe you're noticing, like maybe you're on the phone with somebody and you're kind of getting like, or let's say maybe your like boss is like kind of getting after you for something, and you're just feeling maybe kind of like defeated about it. You are just kind of safe. The softening around the strong emotion is just kind of like letting it in and then allowing and acknowledging that it's here. It's here, so let's not resist it because sometimes that just makes it worse. Checking in with your body, seeing if that is held anywhere in your body. So often we do hold a lot of emotion in our bodies and we don't realize it. So maybe you're noticing, like if it's an anxious feeling, maybe you're noticing that in your stomach. Maybe you're feeling that tension in your shoulders. Maybe you're kind of angry about what your boss just said to you, and you do have some like clenched fists. And then just saying like, may I be at ease in this moment. May I be kind of I think at ease is like a good one, or just recognizing what you need in that moment, and also then recognizing that like this isn't just something that you're feeling, like a lot of other people have also been here, and expanding it to everybody else who's kind of feeling that way too. It just kind of brings in that part of like being a human and kind of not identifying with the emotion itself, just recognizing that it's an emotion that we have as humans, kind of expanding that compassion out to everybody, and not identifying it in that way. And then that really also kind of brings it back around to just being able to soften and allow it to be there, but not be controlling your moment or the rest of your day. There's those. And I would say, like, if you're not going to go through this full quick body scan, two of the like number one places I hear people say that they're carrying tension is in their jaw and their shoulders. So maybe just like throughout your day, you're checking in with your jaw and your shoulders, or maybe in your 3 Ps, when you're reaching for a doorknob to leave your house for the morning, you're like checking in with your jaw, your shoulders, any tension that you have, taking a deep breath. And I just kind of wanted to reiterate a couple things, what mindfulness is, what it isn't, because it can be so hard when I just drop in here and I'm kind of like talking to you guys and leading you in a couple exercises. It really is something that has to be experienced. So I hope that you're getting that experience through these short practices that we've done. Mindfulness is not a replacement for psychotherapy. So while there is a lot of research that indicates it can reduce a lot of mental health symptoms and concerns, it can also kind of increase them. And I think I talked about this last time, but really we're taking a deep look at our emotions and just kind of our reality of kind of our lives. And that can kind of increase the stress initially, before we can kind of learn to accept them for what they are and kind of be with them. So just know that that can occur, and it's really important to seek help from a mental health professional if you do have any of these feelings, especially if you do want to kind of continue to do some mindfulness and some of these things kind of come up for you. Mindfulness itself is not a relaxation exercise. So relaxation is really just kind of one result of mindfulness, but it's not really the purpose. And it's also not like you're not always going to be relaxed. Like sometimes you're going to sit down for a meditation and just kind of be on edge the whole time. Maybe you'll be sitting for like a body scan and just really not be able to focus on anything but maybe the pain in your knee or something. So really mindfulness is to be present with whatever is there in your life. So that's the good, bad, and the ugly, accepting all of it. And you can get a lot of relaxation. So it's really hard for people to kind of tease that out in your mind because relaxation is such a very common result. And just kind of letting all of these good, bad, and ugly things into our lives helps us kind of accept them for what they are and then react to them a little bit less. So it's kind of a paradox in that way. Mindfulness is also kind of not a quick fix. So it's something that unfolds over time, and consistent practice really helps kind of rewire our brain and our biology. So just sitting down to do, you might have felt like really relaxed with that body scan today, but maybe the next time you go and do it, you won't. So it really just does take some kind of consistent practice to really get the benefits of it. And every practice is not going to be your favorite. It's not like a specific technique. It's really kind of an entire way of life, which I know can sound really daunting. But it's just kind of like a new lens and a way that we're choosing to live our lives and kind of relate to the present moment and what's happening. And with that consistent practice, that becomes really, or not really easy, but it becomes much easier when you're consistently doing it, because you are kind of rewiring your brain and making that kind of your brain's go-to. And it's not a religion either. The practices and philosophy are derived from Buddhist tradition, but they're not a religion. However, many people do kind of note some spiritual benefits from practicing mindfulness, especially practicing things like compassion-based exercises and compassion for like other people in the world. Mindfulness, like I said, it takes practice. So regular practice is what produces those biological and structural changes in our brains and our bodies. And there's a saying that cells that fire together wire together. So we're kind of forging those new paths. We're kind of breaking our old habits, our old way of being, and kind of a lot of that for a lot of us is just being very habitual and reactive and just carrying a lot of stress. So and those paths have just been forged over and over for us. So that's just kind of our go-to and what we do on autopilot. So it takes kind of a lot of practice and patience to get this. But when we consistently do it, we are making that kind of the new go-to and the new way of our brain and of our being. And I think I said this last time too, frequency is really more important than duration. So if you like wanted to get strong biceps, you wouldn't go to the gym just once a week for 60 minutes and like knock out some reps. You would go maybe like 10 minutes every day, or like 30 minutes 3 times a week. Really, that consistency and the buildup over time is what's going to get you there. So the research does show even just like 10 minutes can help. And I think we discussed this last time too. Just find 10 minutes that fits kind of into your lifestyle. And I would say try to build it into your day. Don't try to fit it in. If you're trying to fit it in, it's not going to happen. But if you build it in and you like build it into a routine, or you take time to purposely schedule it into your week, into your day, it just becomes a lot easier and harder to kind of put off, or just say, oh, I'll do it later, I'll do it tonight, whatever. And then you just never get around to it. And that 10 minutes a day, the research really is on like formal practices. So formal practices, you can think of kind of like, it's a laboratory. It's a controlled environment. So scientists kind of do experiments and explorations in a controlled environment, like a laboratory. And that's what our formal practice is for us. We get to practice these skills of sitting with maybe unpleasant things, or resisting urges that we have, and just kind of being with whatever's present in this more controlled environment. And then those skills will kind of carry over into our everyday. So the formal practices are really beneficial for that. And just know that you don't have to do one sitting. If you are kind of not wanting to sit right now, although sometimes it's good to make yourself do something you don't want to do, you can be walking, you can do some yoga. If you need to get some movement in, you can do different types of meditation. And then doing those will also kind of help you be attentive and present for some of these more informal things. But I think these are really great to add into your day as well. And I know we're out of time, so this is pretty much my last 2 slides. This is a quote I really like. It says, "We can't always change what's happening around us, but we can change what's happening within us. And we can change how we react to what's happening around us."
Good.
And so these are the resources that I gave you guys last time, those yellow ones. The orange ones are some new ones that I added. And again, I will give these to Angela to give us like handouts to you guys, or to put on the website. Online communities are really great, especially if you do want to keep doing mindfulness practices. Usually there is, well, these 2 at least, there is like a well-trained mindfulness teacher who has had like the kind of gold standard of mindfulness training, and they are leading the practices, and they can just kind of help develop your practice. You can ask them any questions. It's really great to be with other people too, not only for accountability reasons, but just to kind of hear what other people have to say and what their experience is, maybe see how it's different than yours, or help normalize some of the things that you're going through, even some struggles that you're having with your practice or your daily life. Yeah, so I would really urge you to look into some of those communities. Both of these on here, and I'll have links on the handout, have totally free sessions that you can drop into at least a couple times a week.
Oh, awesome.
Yeah. And then Smiling Minds, the app is one that I found since I last talked to you guys. It has some kid-friendly meditations. It's out of Australia. It's totally free, so I would urge you guys to check out that one. It's really cute. I like it a lot. It's become kind of one of my top ones. And then I have some websites for children and teens specifically, if you're interested in kind of engaging your kids in these practices. Some of these do have like paid programs, but there's also just some resources, some handouts and worksheets and blog posts and stuff, so you can just kind of learn more about it. And some link to like community events as well, and have some free meditations and stuff like that. So that's it. Thank you guys again for having me and for your support. It was great to be back with you guys. And you can feel free to reach out to me on this email if you have any questions or are wanting like a mindfulness resource or anything.